Liposuction after tummy tuck. So, my goal with any tummy tuck is to get people's abdomens as thin and tight as I possibly can. The limit to that is keeping the skin alive. So, if I really thin out that abdominal skin, meaning really cut out the fat, suck out the fat with liposuction, and then lift it off the abdominal wall, pull it down, make it really tight, cut out the extra skin and sew it up, a lot of that skin is going to die and you're going to have wound healing problems. So we don't want to do that. So there's a limit to how tight and thin we can make your abdomen after a tummy tuck. Obviously the goal is to make it as thin and tight as we can. So what I like to do is, at the time of the tummy tuck, I will make you as thin and tight as I can. But I do not want your skin to die, and I do not want to put you through wound healing problems. So, to avoid that, I prioritize making your skin tight over sucking out a bunch of fat from your central middle abdomen. So, I'll suck out a bunch of fat from your flanks and your back, but I won't suck out too much fat, or I won't push it too far over the middle center of your abdomen, because if I do that, we could lose skin and have wound healing problems while you're healing from a tummy tuck, and I don't want to do that. Because it's really easy for me to numb you up 6 weeks after your tummy tuck in the office under numbing medicine, numb up that area of your belly and suck it out with liposuction is really easy. And then I can get you even thinner than is even possible at the time of a tummy tuck. So, what we don't want to do though is put you through the healing of the tummy tuck incision ever again. So I prioritize getting your skin nice and tight because I don't want to have to tighten that up again later. But what's easier to do later, and what I can do even better later, is do more liposuction. So that's sort of how I plan the operation. I'm going to do liposuction like I normally would everywhere else on your body. I'm going to make your abdominal skin as tight as I safely can. I'm going to make your abdominal wall as tight as I can, the muscles inside. I will not make your abdominal, the fat on the center of your abdomen. In other words, I will not be aggressively doing liposuction on the same skin that I'm lifting up off of the muscle layer, because it can't handle it. So that is where I will back off on being aggressive, because it's not worth the risk. We'll get you healed from the tummy tuck, at least get you to that 6-week mark after the tummy tuck. The skin all looks good, everything's good. By then, your tissues can handle it. We can numb you up on that little area that I didn't make super thin, and I can suck all that fat out and make you really thin. And that's a much easier, better way to do the whole process than it is to risk losing skin at the time of the tummy tuck. Because even if I do that, even if I make you take that risk and make you a little bit thinner at the time of a tummy tuck, I still can't make you as thin as if I get to do liposuction 6 weeks after the tummy tuck. That's the thinnest I could possibly make you. Because at that point, the blood flow and everything is good and it can handle that, and it's very low risk of any skin having any problems at that point. Extremely low risk, like it's never happened low risk. So that's the way to think about the tummy tuck. So know that. I'll do aggressive liposuction everywhere else except the mid-center of your abdomen, where the skin has a lot of healing to do. We'll let the skin heal, and if it's still too thick and you want it thinner, 6 weeks after the tummy tuck, we'll numb you up and suck out more fat from that area. The beauty is that skin's gonna be numb for a little while anyways. So numbing you up and sucking it out doesn't really hurt all that much because that tissue's already numb from the tummy tuck. And I'm gonna pump a bunch of numbing medicine in you anyways, so don't worry about that. And your recovery doesn't really change because you can't lift more than 20 pounds and you can't lift more than 20 pounds for 2 months, and you have to work compression for 2 months. So if we do this at 6 weeks, it's not adding to your recovery because you still have 2 more weeks of compression, and it's not a ton of liposuction at that point. It's just that middle of your central abdomen that we have to finish thinning out, and that's pretty much it. So I hope that makes sense. It's kind of a hard thing to explain sometimes, but the ultimate goal in the end is to get you the flattest, most attractive abdomen I possibly can with the minimal and lowest risk for any complications. And I've learned the best way to do that is to if we need to, do a little bit more liposuction at that 6-week mark, because there's really no other way to safely make your abdomen super thin and tight. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.